Welcome to Receiving the Best Bladder Cancer Care, the role of supportive care and mental health services. As we begin today's program, I want to thank our sponsors, Merck and Urigen, for their support of the Patient Insight webinar series. We know that a bladder cancer diagnosis can be life-threatening and life-changing. A significant impact of bladder cancer and treatment really changes a patient's health-related quality of life and their emotional well-being. It can also impact the caregiver, the loved one of somebody who's been diagnosed with bladder cancer. There's increasing evidence from cancer research that emphasizes the importance of examining patients' supportive care needs and the received social support as factors that could influence their emotional adjustment as they transition to a new normal of survivorship after bladder cancer. BCAN is delighted to have retired psychiatrist Dr. Deane Wolcott with us today. Dr. Wolcott joined us in Seattle for our summit this year, and he was gracious enough to do an encore presentation for us. Dr. Wolcott has made extensive contributions to the field of social oncology over the years, even spearheading the development of the oncology supportive care services at the David Geffen UCLA School of Medicine and Cedars-Sinai Health Systems. He's going to share invaluable information about the psychosocial impact of having this disease and this diagnosis, and what resources are available for you to handle the mental stress and even the anxiety that often accompanies a bladder cancer diagnosis. So welcome, Dr. Wolcott. It's a delight to see you again.
Thank you again, Dr. Chisholm, for this invitation. I'm very much looking forward to our time together. What I really wanted to do today, and I have some initial takeaways, but what I really want to do is share with you initially some perspectives on what really are the components that make up truly outstanding bladder cancer treatment and care. Some of the dimensions of life that are impacted by bladder cancer and its treatment. What oncology supportive care services means, that's a term you may not well have heard before, but we'll talk a little bit about that. Really fundamentally, it's putting together all of the components of truly whole person centered care for patients and also supporting family members and caregivers. Then we'll talk a little bit about symptoms and then specifically some of the common psychological symptoms that exist and what are some of the best principles for helping manage them. So I wanted to start out with some key takeaways that I hope I will be able to explicate to your understanding as we go through the rest of this time together. First is that optimal bladder cancer care seeks to restore full patient well-being in all major life dimensions. And I'll shortly show you a slide of the dimensions, most of which we're very familiar with. But historically, in many situations, cancer treatment has focused, understandably, on diagnosis and treatment and has tended not to focus as much on all of the aspects of a person's life that can be stressed and that we want to restore to full function and full quality of life. So that's what is a core element of optimal bladder cancer care. I'm going to talk about oncology supportive care services as being really a critical component of this comprehensive patient-centered care program. Obviously, many of you know from your own experience or with family members who have bladder cancer that psychological distress is common. Now, it's common in essentially all cancers at various points in the cancer journey, but there is evidence that because of the specific nature of bladder cancer and the stresses of treatment and the impact on bladder function and often surgical procedures that are required, that bladder cancer patients experience a somewhat higher level of psychological distress than other cancer patients at a similar phase of illness. And therefore, both psychological and psychiatric services are important components of overall supportive care services and of optimal oncology care. BCAN, as I'm sure you all know, for those who are participating in this webinar, is an outstanding organization It provides a wide variety of really important services from the standpoint of education, from the standpoint of support, of helping to create community, providing and access to a wide variety of other important resources. But there are also other important national cancer education and support organizations, not really focused on bladder cancer, but more generally, that are really important parts of whole person patient and family bladder cancer care. So I'm going to talk now a little bit more specifically about the elements on this slide. We're going to talk about the human impact of cancer and cancer treatment throughout the illness journey, specific challenges of bladder cancer and bladder cancer treatment, the best models of comprehensive integrated oncology supportive care services, then focus on the specific mental health challenges and the optimal role of specialized mental health care in helping individuals meet those challenges as they go through their own illness journey. This is a slide from the Institute of Medicine, which really was one of the first organizations to really articulate what should be the components of bladder cancer care or cancer care in general. And as you look here, as they lay out longitudinally the various phases that may apply to individuals throughout their bladder cancer journey, there are a number of important services. You see them in really the blue arrow: care planning, palliative care, psychosocial support, prevention and management of long-term and late effects, and family and caregiver support. I want to just talk a little bit about palliative care because the term palliative care and the services of palliative care are often misunderstood both by healthcare professionals, including those who are treating cancer patients, and by patients with all diseases, including cancer and bladder cancer. Palliative care is really a service, as this slide indicates from the Institute of Medicine, that should be available to all patients from the moment of diagnosis forward. And this is the reason why. Palliative care is a clinical service made up of physicians, typically, and nurses and social workers, and often spiritual care and other pharmacists and other members, whose focus is on optimizing symptom management. Many patients have symptoms with bladder cancer that are relatively easily managed by their primary bladder cancer treatment team, but some have very complex symptoms from a very early stage of their diagnosis and treatment. So palliative care focuses on symptom management. It focuses on patient and family education, making sure that patients and family members are fully involved in helping make decisions about the treatment plan going forward. So this slide emphasizes appropriately that palliative care is a component of care that should be available to all patients from the moment of diagnosis forward. And over the last 10 or 15 years in the United States, we're starting to see the vast majority of hospitals now have palliative care services. More and more of the major cancer treatment organizations and bladder cancer treatment teams have access to palliative care services. And this is not in any way competing with the primary bladder cancer treatment. This is an adjunct. It should be collaborative, and it can provide great value both to patients and also to their primary oncologists and nurses and others who are involved in their primary cancer care. This just makes the obvious point, as also was made by the Institute of Medicine graph that we just showed, that there are phases of illness from pre-diagnosis and diagnosis through those who have completed initial treatment, often called the survivorship phase of illness, those patients who have recurrent disease. Some patients go on to have more advanced disease and approach the time when they have limited life expectancy. Some develop very advanced disease and are approaching the end of life. And then there are families and caregivers who may experience bereavement and also benefit from receiving services to help them recover from their own grief. So many patients do well early on and never develop advanced disease or approach the end of life. But for those who do, it's important that a care system really focus on ensuring that we understand the patient's need at each phase of their journey, and that we put together the optimal care plan to help them cope and maintain the best quality of life for as long as possible. This is just simply one model of what are the interrelated dimensions of life that we really want ideally to restore in bladder cancer treatment. There's obviously the physical dimension, which is a great focus of bladder cancer diagnosis and treatment teams. There's the psychological dimension. We'll talk more about that. There's the impact on social relationships, on family members and caregivers. And for all cancers, it's really true that cancer is a diagnosis that impacts an entire family, not simply the diagnosed patient. And this is especially true, I believe, in bladder cancer because of the unique stresses associated specifically with bladder cancer. For many individuals, there is a spiritual dimension of the impact of cancer on their life, and the diagnosis of cancer and the life course with cancer may cause spiritual distress for many patients. Then there's what I call the productive and vocational dimension of life, which really is a way of stating everything that we do that has a positive impact on life. Our role is in our jobs, our careers, our vocations, the contributions we make to a community, in community organizations, the contributions we may make in the life of a religious community, contributions to the life of our family. So that really everything that we do that one can see as being productive or vocational is what is intended to be implied by that slide. As we've already said, bladder cancer typically stresses all of the life dimensions we've just articulated, and optimal care for bladder cancer patients involves really understanding and focusing on the dimensions and the impact that the cancer and its treatment is having on that patient in those life dimensions, and helping that patient cope most effectively with these life stresses. Bladder cancer, and we'll talk a little bit more, and its treatment is inherently stressful and traumatic. And we're going to talk a little bit more about trauma and as one of the dimensions of the psychological stresses of bladder cancer. And bladder cancer is often associated with losses in multiple life dimensions, and we'll talk more about that in a little bit also. And as we've also already said, that it's really a family disease, and it often has significant impacts on family members and caregivers. And that as we're talking about optimal care, we really need to understand and support family members and caregivers as they support the patient through this illness and its treatment. Bladder cancer treatment teams, and there are a fair number of centers of excellence for bladder cancer care in the United States. And there are many wonderful teams. Many patients also receive some of their care in the community environment, where some of the full range of ideal resources we're going to be talking about may be much more difficult to actually be able to access. But as we talk about both symptoms and specifically psychological symptoms, the bladder cancer treatment team is very important in providing what we call primary care for these symptoms, and is often very accessible and very effective. And we very much value, and as we talk about some of the specific tertiary mental health care aspects of dealing with distress and managing psychological symptoms and approaches, we always want to focus also on the fact that the primary teams are really major sources of education and support, and often symptom management and distress management. As we've really already said, common psychological symptoms in bladder cancer arise from trauma and loss and uncertainty and fear. And these are often major interrelated contributors to anxiety and depression and other symptoms that we often describe as being psychological symptoms. It's very important to recognize and to state that many patients cope very effectively with their illness and its treatment and are highly resilient thrivers. In the history of my field of psychosocial oncology, much in the early days of that field, we spent a lot of time talking about stress and distress and symptoms. And over the last 10 years or so, a lot more attention is appropriately being paid to the fact that many patients cope very well with their illness and its treatment, come back into very full lives, and really are thrivers in the best sense of that term. So what should the bladder cancer treatment team specifically be doing to help support the patient from a whole person perspective? They need to provide the patient with full personalized information and education concerning all aspects of the cancer journey: the diagnosis, the treatment status, treatment plan options, including explaining what are the likely benefits of any given course of treatment, what are the likely toxicities and costs, both personal costs and financial costs. The team should also be optimally coordinating care among all bladder cancer treatment team members. And in many cancer settings, I can tell you that it's often fairly difficult to coordinate care if treatment providers are not in one space. For instance, radiation oncology may be in one department or one space, or in another place, and surgical oncology and infusion centers and medical oncology. So care coordination is critical for teams. They need to be providing, and often do, wonderfully empathic, caring care and emotional support as part of their treatment team role. They need to manage the patient's symptoms and distress within the scope of their expertise, and they need to be fully collaborating with the patient and family in all major treatment plan decisions. In my view, and based on their many important national standards of care about how we should be caring for patients, including bladder cancer patients, all bladder cancer patients should have a bladder cancer nurse navigator. And almost all teams have, to my knowledge, and these often serve a major role in education and care coordination and helping the patients navigate through a complex system. In my view, also, every bladder cancer patient also should have access to a supportive care and survivorship care navigation services. And these services are typically provided by oncology social workers who are a critical part of this comprehensive patient navigation and support process. I believe that all patients should have access to a full supportive care services team, and we'll talk a little bit more about that in a little bit. And I'm going to say again that BCAN is a critical part of the bladder cancer treatment system from my standpoint. And every single bladder cancer patient should know about BCAN, should be referred to BCAN, should have access to BCAN, and should have the opportunity to participate in the wide variety of services that BCAN provides. BCAN has a relationship with another wonderful organization called Cancer Care that has social workers that are highly trained and focused on supporting patients with bladder cancer. And there are other important organizations also. So it's not only what happens within your treatment team in the medical setting, it's also accessing organizations such as BCAN that are critically important to optimizing the patient's support and outcomes. This is a very complex graphic slide, but it simply makes a point, and we're not going to go through this in any detail, that if you look at the needs of cancer patients, including bladder cancer patients, at various points in time throughout their illness journey, there are a wide variety of needs for services, for professionals to provide those services. I really think that if you look at the center circle, these are the services that, in my view, every single patient should have access to throughout all of the cancer journey. Patient navigation, we've talked about, dietitian services, both for education and consultation, social work services, and also symptom management services. Many of these other services, including so-called psycho-oncology services provided by psychologists and psychiatrists, can be very important for a subset of patients, but these core services are critically important, and many of these services really should be part of services you have access to if you're receiving care from a bladder cancer center of excellence. This is another way of really graphically presenting what I've just talked about who are the elements, who are the care providers of the optimal oncology supportive care team. The nurse navigator, the social workers, the dietitians, psychologists, and psychiatrists for patients who have that level of distress and need that level of support, rehabilitation medicine, and spiritual care. I know BCAN has been very important in supporting research on prehabilitation and rehabilitation, and that's a very important part of cancer care that often is not as fully emphasized as it should be. And then we've talked about the importance of symptom management, which often goes under the term of palliative care. And as we've said before, excellent symptom management, including management of complex and difficult symptoms, should be available to the patient from the moment of diagnosis forward, whatever their patient journey is. Again, looking at the same kind of challenges, but again, looking across the entire patient journey, that over and above the services that we've already talked about, there are patients who approach the end of life who should receive really excellent symptom management care, which might be under the auspices of a palliative care service, and should receive appropriate referral for hospice and other comprehensive end-of-life care when they reach that stage of their illness. I want to I've really talked about BCAN a lot, and I'm repeating this, but there are a lot of educational materials. BCAN has wonderful materials, and there are many other sources of really wonderful educational materials related to cancer, including bladder cancer and its treatment. Peer-to-peer support and professional-led support groups are provided by BCAN and many other organizations, very important for helping managing distress and providing support with peers and colleagues. There are many sources of services that are focused on helping individuals live a healthy lifestyle, managing stresses, and so forth. Many of them available, for instance, through the internet and on webs. I'm just going to mention that there are a variety of digital applications that have been developed, some of them really focused on providing support for psychological distress in patients with cancer. We're in early phases of that part of our care system, but over time, I think that's going to add a significant amount of value to the care of patients, including bladder cancer patients.